going into major treatment of any kind is important. Carcinoid can affect the heart specifically, and we have had a number of patients through who have had heart surgery either before or after their treatment, and because the heart had been affected by the carcinoid. And one of the things we're doing as part of our MDT in St. Vincent's is we're sending all our carcinoid patients who have a hint that there might be a heart trouble to the same cardiologist, Martin Quinn, so that he will begin to increase his expertise with carcinoid related heart problems, and to give advice on the timing of when to intervene. And in terms of heart surgery, we're already using a dedicated cardiac surgeon whose particular specialty is valve surgery, which is what gets affected by carcinoid, and so that we have that everybody's expertise is improving, and it goes beyond the team you have here to things like cardiology and cardiac surgery. And pass you on to.
So basically anybody who would be diagnosed with midgut carcinoid, we would have a cardiology review anyway. Now it's predominantly the patients with carcinoid syndrome that are affected, but if you're going to go for any kind of a major surgical resection, you'll be automatically reviewed by a cardiologist.
Unfortunately, there is a reality in my experience and my working experience in a big neuroendocrine center in Paris as well, and in dealing with the people involved. But it's fair to say, I think, that surgery to replace usually what we call the tricuspid valves on the right side of the heart.
There is some we have noted a strange thing with the cardiac heart disease, that it was very common 10-15 years ago. Then it almost disappeared. The patients were not that sick anymore for, let's say, 5-7 years backwards and on, until very recently it has come back. We have no idea why, if it's just happens to be like that, or if it's a trend. I think it's very wise, as you're planning, that to let the cardiologist, a special cardiologist, gather the experience, and we've done that in Uppsala with our cardiologist Lennart Lundin. The thing is, now he's retiring, so we have to find another one. That's the current problem for us, and also special thoracic surgeons, because it's not many patients, and it needs a special interest in the field, I think.